NLN NEX 2026 Study Guide. Question 1. Which sum equals 1/6 plus 1/6 in this lung function item? Option A, 1/6. Option B, 0. Option C, 1/3. Option D, 1/3, 1. The correct answer is option. The denominators are already the same, so add the numerators, 2 plus 2 equals 4, then simplify to 1/3. The other choices subtract the numerators, multiply parts of the fractions, or change the denominator unnecessarily. Question 2. During a quick NEX review of a digestive process item, which word is closest in meaning to require in a classroom review sentence? Option A, whisper. Option B, borrow. Option C, need. Option D, avoid. The correct answer is option. Require means need, so that choice matches the meaning in context. Whisper means speak softly, not need. Borrow means take temporarily, not need. And avoid means stay away from, not need. Question 3. After checking the choices in a homeostasis item, which answer identifies the substance dissolved in a solution? Option A, precipitate. Option B, solute. Option C, solvent. Option D, catalyst. The correct answer is option. The solute is the material being dissolved. Precipitate is a solid that forms in solution, solvent does the dissolving, and catalyst speeds a reaction. Question 4. If a scientific method STEM gives one clear clue, which statement gives the best main idea of this passage? A report says infection rates fell after staff completed a hand hygiene refresher. Option A, training may have improved compliance with hygiene practices. Option B, hand hygiene cannot affect infection. Option C, the refresher removed all risk permanently. Option D, training increased infection rates. The correct answer is option. The sequence suggests training supported better hygiene behavior. Hand hygiene cannot affect infection, is not supported by the passage. The refresher removed all risk permanently, is not supported by the passage, and training increased infection rates, is not supported by the passage. Question 5. When time is limited on a control group question, which increase is shown from Monday 15 to Wednesday 25 in a simple practice chart? Option A, 7. Option B, 25. Option C, 10. Option D, 40. The correct answer is option. The increase is the final value minus the starting value, 25 15 equals 10. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 6. Given the information in a sample size item, which dose volume gives 75 mg from a supply of 50 mg per 5 ml? Option A, 15 ml. Option B, 1.5 ml. Option C, 3.75 ml. Option D, 7.5 ml. The correct answer is option. Set up the proportion 50 mg, 5 ml equals 75 mg x ml, so x equals 75 times 5, divided by 50 equals 7.5 ml. The other volumes reflect errors such as doubling the dose, having the dose, or reversing the proportion. Question 7. Suppose a similar enzyme activity item appears on test day. Which word is closest in meaning to sufficient in a classroom review sentence? Option A, recent. Option B, visible. Option C, enough. Option D, inadequate. The correct answer is option. Sufficient means enough, so that choice matches the meaning in context. Recent means new, not enough. Visible means seen, not enough. And inadequate means not enough. Question 8. While working through a timed pH scale set, which answer identifies the transfer of heat through direct contact? Option A, evaporation. Option B, radiation. Option C, conduction. Option D, convection. The correct answer is option. Conduction transfers heat when particles collide through direct contact. Evaporation is liquid changing to gas, radiation transfers energy by waves, and convection moves heat through fluid circulation. Question 9. Before choosing an answer in a solution chemistry item, Which statement gives the best main idea of this passage? A clinic sends appointment reminders, and missed visits decline. Option A, reminders can help patients remember appointments. Option B, patients cannot benefit from reminders. Option C, appointments no longer need scheduling. Option D, reminders caused more missed visits. The correct answer is option. The decline in missed visits supports the role of reminders. Patients cannot benefit from reminders is not supported by the passage. Appointments no longer need scheduling is not supported by the passage, and reminders caused more missed visits is not supported by the passage. Question 10. A student sees this genetics clue idea on a NEX review. Which answer identifies the transfer of heat through direct contact? Option A, conduction. Option B, radiation. Option C, evaporation. Option D, convection. The correct answer is option. Conduction transfers heat when particles collide through direct contact. Radiation transfers energy by waves, evaporation is liquid changing to gas, and convection moves heat through fluid circulation. Question 11. One cell division practice problem tests this skill, which average results from scores of 65, 69, and 73. Option A, 69. Option B, 8. Option C, 207. Option D, 67. The correct answer is option. Add the 3 scores to get 207, then divide by 3 to get 69. The other choices use the sum, the range, only 2 scores, or an added value rather than the mean. Question 12. Several choices look tempting in a bone support item. Which word is closest in meaning to abundant in a health article? Option A, silent. Option B, plentiful. Option C, fragile. Option D, scarce. The correct answer is option. Abundant means plentiful, so that choice matches the meaning in context. Silent relates to sound, not amount. Fragile means easily broken, not plentiful, and scarce means limited, not plentiful. Question 13. For this muscle movement nursing entrance question, which answer identifies the repeating a study to see if results hold? Option A, bias. Option B, classification. Option C, replication. Option D, estimation. The correct answer is option. Replication checks whether results are reliable across repeated trials. Bias is a systematic error, classification is grouping items, and estimation is an approximate calculation. Question 14. In a short nerve signal practice STEM, which statement gives the best main idea of this passage? A study found that students who practiced with timed sets felt more comfortable during the actual exam. Option A, timed practice can build exam familiarity. Option B, comfort never changes with practice. Option C, timed sets remove all content gaps. Option D, the exam has no time pressure. The correct answer is option. The passage connects timed practice with increased comfort. Comfort never changes with practice is not supported by the passage. Timed sets remove all content gaps is not supported by the passage, and the exam has no time pressure is not supported by the passage. Question 15. Among the choices in an endocrine message item, which critical thinking response best fits this situation? A patient says, "I feel better, so I stopped the medication early," in a health literacy passage. Option A, teaching is unrelated to medication use. Option B, medication should always be stopped early. Option C, the statement shows a need for clearer teaching about completing treatment. Option D, the patient fully understood the instructions. The correct answer is option. Stopping early can be unsafe depending on the medication and condition, so teaching is needed. Teaching is unrelated to medication use does not follow from the situation. Medication should always be stopped early does not follow from the situation, and the patient fully understood the instructions does not follow from the situation. Question 16. Using the facts in a glucose regulation question, which 4 flow rate delivers 0.25 L over 5 hours using a 20 GDT/ml set? Option A, 1000 GDT/min. Option B, 50 GDT/min. Option C, 1 GDT/min. Option D, 17 GDT/min. The correct answer is option. Convert 0.25 L to 250 ml, then use 250 times 20 divided by 5 times 60 to get about 17 GDT/min. The other choices come from common errors such as skipping the drop factor, using hours instead of minutes, or rounding before the final step. Question 17. Based on the clue in a chart reading item, which word is closest in meaning to anticipate in a health article? Option A, delay. Option B, expect. Option C, erase. Option D, repair. The correct answer is option. Anticipate means expect, so that choice matches the meaning in context. Delay means postpone, not expect. Erase means remove, not expect. And repair means fix, not expect. Question 18. Consider this high-yield ratio setup concept. Which answer identifies the tiny vessel where nutrient and gas exchange occurs? Option A, artery. Option B, capillary. Option C, trachea. Option D, vein. The correct answer is option. Capillaries have thin walls that allow exchange with tissues. Artery moves blood away from the heart, trachea carries air, and vein returns blood to the heart. Question 19. Near the end of a unit conversion review session, which inference is best supported by the passage? A patient education sheet used short sentences, headings, and pictures. Option A, clear formatting helps readers understand health information. Option B, long paragraphs are best for patient teaching. Option C, pictures make written instructions unnecessary. Option D, headings reduce the value of information. The correct answer is option. The sheet is designed to improve readability and comprehension. Long paragraphs are best for patient teaching, is not supported by the passage. Pictures make written instructions unnecessary, is not supported by the passage. And headings reduce the value of information, is not supported by the passage. Question 20. Across similar percentage item nursing entrance questions, which increase is shown from Monday 14 to Wednesday 22 in a simple practice chart? Option A, 36. Option B, 22. Option C, 5. Option D, 8. The correct answer is option. The increase is the final value minus the starting value, 2214 equals 8. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 21. Since only one choice fits the fraction item clue, which value of x solves 7x plus 4 equals 95? Option A, 12. Option B, 14. Option C, 13. Option D, 91. The correct answer is option. Subtract 4 from both sides to get 7x equals 91, then divide by 7 to find x equals 13. The other choices result from stopping after subtraction, adding 1 too many, or not reversing the operations in the equation. Question 22. From the information in a mean score item, which word is closest in meaning to cautious in a health article? Option A, reckless. Option B, frozen. Option C, cheerful. Option D, careful. The correct answer is option. Cautious means careful, so that choice matches the meaning in context. Reckless means careless, not careful. Frozen means very cold, not careful. And cheerful means happy, not careful. Question 23. At a testing desk during a probability set review, which answer identifies the organ that produces bile? Option A, pancreas. Option B, kidney. Option C, gallbladder. Option D, liver. The correct answer is option. The liver produces bile, which helps digest fats. Pancreas secretes enzymes and hormones. Kidney filters blood, and gallbladder stores bile. Question 24. Inside a test strategy science or skills item, which inference is best supported by the passage? A volunteer program grew after former patients shared personal stories at orientation. Option A, personal stories can motivate people to participate. Option B, former patients stopped the program. Option C, volunteer programs grow without communication. Option D. Orientation should never include stories. The correct answer is option. The passage shows participation increased after meaningful stories were shared. Former patients stopped the program, is not supported by the passage. Volunteer programs grow without communication, is not supported by the passage, and orientation should never include stories, is not supported by the passage. Question 25. Through careful reading of a main idea stem, which answer identifies the group that does not receive the experimental treatment? Option A. Conclusion. Option B. Sample. Option C. Control group. Option D. Experimental group. The correct answer is option. A control group provides a comparison for the treatment group. Conclusion is the final interpretation. Sample is the participants or items studied, and experimental group receives the treatment.